All right. Hello, hello, and welcome to Hygiene Elevated Conversations and Innovations. My name is Olivia Badunde, your host for today, and I'm so honored to have with me Haley. Thank you so much for being here, Haley.
Hi, thank you, Olivia, so much for having me. I'm honored.
Yeah, it's a pleasure. So, we always like to find out on Hygiene Elevated how you got into dental hygiene in the first place. So, let's hear your story.
Well, I have been a hygienist since 2012, and I was actually inspired chairside by my aunt. My aunt is a
Great.
dental hygienist, and I had her work on me all the time. When I first went into college, I wasn't 100% sure if I wanted to do physical therapy or if I wanted to do dental hygiene. And
Mhm.
I ended up doing dental hygiene, but now here I am doing some things that have physical therapy involvement as well. So I was
Yeah,
inspired chairside.
the best of both worlds. And
Absolutely.
what was it that she said or did that clicked with you and you said, "Okay, I should go for it?"
I just think I loved going and spending time with her, and I
Oh.
loved spending time at the dental office. I
Mhm,
was kinda, nerdy. I loved braces. Had the best at any dental office or ortho office that I had ever been to, and so,
mhm,
doctor side in the medical, not my favorite place to go back then,
mhm,
but I
mhm,
enjoyed being in any dental practice. It was fun for me as
mhm.
a kid.
Yeah, I felt the same, and actually, my niece just got accepted to dental hygiene school.
Ah, congratulations to her.
I'm so proud of her, so we just keep repeating the cycle. All the cool aunts influence the nieces.
Exactly, exactly. It's so cool.
So I'm sure when you decided to go into dental hygiene, you probably didn't imagine that your career would turn out the way it has now. So can you kind of take us through after hygiene school? What happened? Where did you work? And how did you end up with what you're doing now?
Sure. And I tell people, I am one of those that when I originally applied to dental hygiene school, I was not accepted my first year. And I truly feel like that has motivated me to do everything that I do now.
Mhm,
To have someone tell you this is probably not the career for you, and all because I
mhm.
had a C. But I'll tell you, I took that as challenge accepted, and
Mhm,
it has completely turned everything around for me. I worked really hard in school, became president of the class. Before that, I was a dental assistant. So I had got some experience back then. And
mhm,
then I kept going and kept working. And after I graduated, I found the job of my dreams. I subbed the first time I subbed there, which was my very first shift as a hygienist. I said, I hope that I find an office like this to work in. Sure
mhm,
enough, I ended up taking a full-time position there. I had some amazing mentors that helped
mhm,
me. And then it was over COVID times where I started thinking, what next? And I went for my bachelor's. I got my bachelor's in public health just in case. What if I don't do dental hygiene? And what if I break my wrist and I destroy it and can't ever work again? And so then I ran into myofunctional therapy. And so I kept looking, what is this oral facial myofunctional therapy? I took a quick course that was just kind of a dive in, a seminar that you could see what it was. Changed my life. I fell in love. I dove in and I've never looked back. Still
mhm,
love dental hygiene, still have such a
mhm,
passion for it. I also have a huge passion for oral facial myofunctional therapy, airway dentistry. I'll never look at the mouth the same.
mhm,
I feel like it has truly advanced our dental hygiene career. It can change
mhm,
it around. We are the front lines for airway.
mhm. So now do you still practice as a clinical hygienist at all?
I do. I do. I do
You
about 2 to 3 days a week at a practice
Okay.
here on the south side of
Mhm,
Indianapolis. Love my
mhm,
patient. When I jumped in, I know a lot of people who, when they jump in OMT, sometimes they're looking for something other than dental hygiene. I was
mhm,
more so looking for an addition to. What
mhm,
else can I do to take my career further? How can I make a
mhm,
deeper impact? As
mhm,
hygienists, we see all these clinical signs for so long. I'm not big on just throwing a mouth guard in. And for
mhm,
years, when we did that, I thought, yes, we're protecting the teeth, but what's causing it? What's the root cause of all this that I'm seeing
mhm,
every single day?
mhm,
And now I know that a lot of times it's not just stress like what we thought for a long time. It's
mhm,
actually stemming from airway problems and in every age.
mhm,
We tell kids for so long they'll grow out of that. We
Mhm.
laugh at snoring. It's just a funny thing that we used to, laugh at. Oh yeah, he snores and keeps me up all night, or she snores and keeps me up all night.
Mhm.
But it's a deeper problem and it's a huge, huge red flag. And
Mhm.
now I'm equipped to be able to talk to my patients about that when I'm working with them in the clinical hygiene field. So
Mhm.
I'll never give up hygiene. I'll keep
Mhm.
it.
I totally understand. Now, I feel like most of our conversation is going to focus on Mayo, but before we jump to that, I want to hear a little bit about this office that you worked in, where you said it was your dream office and it was so
Mhm.
great. Can you tell me about some of the characteristics of that office that made it such a great place to work?
For me, it was the people I worked with. It was
Mhm.
dental hygienists that had been doing this for years. I was at that practice for about 10 years. And
Mhm.
funny enough, now I still work with some of those hygienists. And one of them
Mhm.
is part time in my practice with me, and the other
Mhm.
one, she subs with me. And so I have
Mhm.
been so lucky to have
Mhm.
some of these people mentor me. Another woman that was there, they just, I wasn't afraid to make a mistake, wasn't afraid to admit I don't know it all. I
Mhm.
need help, and I was fortunate enough to work for a dentist who also allowed me that time to take, because when you come out of school, for me at least, I would
Mhm.
spend 2 hours on a prophy still and sweating the whole time thinking, "Have I got every single thing?" And they
Mhm.
made me feel like it's okay to not know it all, and these things will come with time, and I think having that support system is huge, and if I recommend that for any new grad. Find a team that supports you, that's there to
Mhm.
help you, that will
Mhm.
continue your learning and your education, because
Mhm.
I think we all know that right when we come out of school, there's so much more to learn. And the
Mhm.
real world is certainly very different from our clinical world,
Mhm.
when we're in dental
Mhm.
hygiene school.
Yeah, that's great advice. And I asked from the lens that now I'm a practice manager. And so I really want my environment that my team works in I want them to feel that way,
Absolutely.
supported. And whenever I do research about healthy teams, that's one of the main characteristics is that you need to feel safe to make a mistake. So, how long after you finished hygiene school did you start your myofunctional therapy career?
Oh goodness. I started my myofunctional therapy career in 2022. So I graduated in 2012. So we're talking a good amount of time there. Is when
Okay.
I officially opened my practice.
So, when it came to getting your practice started and making
Mhm.
an impact with people, how long do you feel like it took you to really be confident in the care you were delivering as a myofunctional therapist and really seeing a difference with your patients?
Oh, I'm still learning.
Yeah.
I still learn all the time, and I tell
Mhm,
people this is a field where there's still so much evolving in this field. And I still feel like that with dentistry and dental hygiene. We're constantly evolving, we're constantly
mhm,
learning. There's new research all the time. And
mhm,
someone told me, my one of my mentors had told me, go ugly at this.
mhm,
Nobody goes into a business having everything completely perfect. And then when I started seeing new clients, I was super open and honest with them too, that this is a new
mhm,
experience for me. I do have the dental hygiene background. So, and I'm confident enough in that to make myself confident in what I'm doing for airway. And
mhm,
I focus on airway all the time. And I'll tell you, in my chair, people will say, in 30 years, I've never learned as much from my doctor as what I just learned in my 45 minutes with you in your chair. And that's
mhm,
huge. That impact
mhm,
is huge, because now I realize how many people, they'll come and see you as a hygienist every 6 months, but they don't go to their doctor. You are the one who is doing a lot of these. I think you should have this checked. I think you should have blood work for this checked. I think you need a sleep study. And I've had people come back at their 6 month in tears, because they did go get a sleep study. They had severe sleep apnea, and it was ruining their lives, and they did not realize how much it was ruining their lives until that they fixed it. But no one had ever said anything to them about it. And
mhm,
so that for me is huge. And so the more stories I hear like that, the more confidence I gain. And
mhm,
a lot of times I'm referred to a lot of people. We will use a dentist or airway orthodontics or ENTs.
mhm,
Sometimes we bring in allergists, things like
mhm,
that, where it's not just us craniosacral therapists. whole
Mhm.
deal. So it's a network.
Yeah, there's nothing like having a partner to kinda guide you through and help you
Mhm.
step by step, so that's great. Now, I love that piece of advice to start your business ugly and just get started. A lot of our listeners
Mhm.
are exploring different ways they can expand their career. Do you have any other guidance for someone who's starting out a new business?
I would tell them to not be afraid. Don't underestimate yourself. You will have setbacks here and there, and that's okay. I I've
Mhm,
changed some of the brochures and things that I use over time. I started out with some very cheap ones, and then I add things as I'm able to afford it. I
mhm,
quickly realized that I don't need the best of everything yet for marketing or all of that because I'm just not there yet. And I'm not trying to reach that level of people when it comes to getting clients. For me,
mhm,
right now, a lot of it is just the impact that I'm making and not so much the money. And
mhm,
so I have been, and I always tell people, especially if you're getting into a field where not many people are aware of it yet. I can't tell you how many people looked at me when I told them that I was going to become an oral facial myofunctional therapist and open my own practice. I got blank stares, and I quickly realized that it's not because they don't believe in me or think that I would be a good candidate for this. It's because they just don't know what it is that I'm doing. And so
mhm,
education goes a really long way when you're growing your business. And keep
mhm,
in mind that when somebody doesn't make you feel like you're doing the right thing, you are. You have to trust in yourself. You have to believe
mhm,
in yourself and lead
mhm.
your own way. Be a leader to yourself, not just to others.
That's really good advice. So I want to hear about the impact that you're making with your patients. When you think about the patients you've worked with over the years, is there a patient that stands out that you were able to help them with a certain issue?
Oh goodness, I have a few of them. I think
Mhm,
I think some of my biggest accomplishments are some of the jaw problems. That's a tough one. It's difficult. I've done some training with the Breathe Institute to learn more and dive in. I originally when I jumped into this thought that my thing was going to be adults. And when you're working with an adult, you have to keep in mind that they've been doing this for 50 years. The things that they do, they've established these habits for 50 years now. And it's really hard to change. And
mhm,
so it's difficult to make those changes quickly and to
mhm,
not overwhelm them. But what I have found now is the more children that I'm working with, that if I can catch these things early and prevent these children from having to deal with all the things that most of us as an adult has had to, that is amazing. And I've had a woman come in who, I've pointed out in my dental hygiene chair. I don't know if anyone's ever talked to you about a tongue restriction and possible sleep apnea for your child, but these are the symptoms that they're presenting with. I'll mention it to them. And I had a woman, she went out in my waiting room and she was kind of Googling around and flipping through her phone and she just comes back in tears. And she said, I had no idea. I had no idea. We've been dealing with these things for years. No one has ever discussed this with me. I think that where I see a lot of the change is with parents, with just how I
mhm,
make parents feel because it brings relief to them. And that's
mhm,
always so memorable to me because these parents are fighting and advocating for their child and doing everything they can, but never getting any answers to what's truly happening. And
mhm,
so those conditions present with the same symptoms. So I tell
mhm,
people a lot of times it's not, and I'm not saying that someone doesn't, but sometimes it's not a matter of, an attention disorder. It's more of a sleep disorder, and they are not sleeping. Their airway is being cut off when they're sleeping, and their oxygen is being cut off, and they're not getting into the right sleep cycles, which in turn, this is how they're acting during the day.
That's awesome. I'm so happy you're able to impact your patients and help them in that way. I want to pick on something you said. You mentioned when you're working with adults that it's really hard to untrain something that you've been doing for 50 years. And I know one thing is breathing properly. I saw one of your Instagram reels and you talked about this chest breathing. And then I'm looking at
Mhm.
my own breathing. How am I breathing? And so, if you realize that you're not breathing properly, how can you train yourself? How long would that take to really breathe properly? Is that something you're constantly doing?
Yeah, I do 6-month programs and 12-month programs for my
Mhm,
clients, and a
mhm,
lot of them, I'm kind of like a lost tail. Many of
mhm,
them have already done yoga courses and things, so there they learn about the belly breathing. But
Mm,
to actually incorporate that every day takes time. That takes
mhm,
exercises that you're doing, takes
mhm,
compliance. And
mhm,
why when we breathe from up here, I call it shallow thoracic breathing, it
mhm,
actually affects our central nervous system. It throws your body into fight or flight, and
mhm,
we become more anxious. There's even
mhm,
depression that has been found with doing that. And so looking at some things like buteyko breathing, or there's so many books out there that explain the importance of it, but really learning how to breathe from the belly is important.
mhm,
It's important to get that better quality of breath.
mhm. And I also want to hear you talk a little bit about fascia. I've learned that there's a relationship between even our fascia with our TMJ to our pelvic
Mhm.
floor. Can you share anything interesting about that?
I had a girl who I had in my class with me, and I tell people all the time, I'm not sure how much I would have really believed this if I didn't talk with someone who had been through it. But she, worked out plenty and was a very fit young woman and had never quite been able to touch her toes. And she
Mhm,
was also a hygienist. After
mhm,
she had her tongue release done, 2 days after, she could touch her toes,
mhm,
which is just wild to me. Of
mhm,
the videos with the Breathe Institute, Dr. Zoggy, he is an ENT in Southern California, head of the Breathe Institute. He talks about how, doing a tongue release for some people and that frenectomy has helped with plantar fasciitis. And once they release that tissue under the tongue, their feet fall sideways because
mhm,
everything is so bound up. That small
mhm,
string under the tongue
mhm,
reaches all the way down to the toes. It
mhm,
changes the way that people walk, it changes their posture, it
mhm,
changes, a lot of the headaches and the tension of the neck and the shoulders.
mhm,
Releasing, I've had people immediately feel relief the second
mhm,
that they've had that done. And
mhm,
I was talking with somebody, that one of my clients the other day, and she said, I can move my neck way more than what I've ever been able to.
mhm,
I just don't think that we realize the impact that that makes once all of that is so bound up and so tight, and just having
mhm.
that short string under the tongue that can do so much to our whole body.
Mhm. And is that the only way to release it? Like maybe they don't have a tongue tie, but maybe their fascia is tight. Are there other things that can be done besides the
I
frenectomy?
I have people work with a cranial psychotherapist. I tell people all the time, just because you might have that short lingual freedom doesn't always mean that it needs to be addressed. I've had
Mhm,
people that have those short freedoms that their form and their function is fine. There
mhm,
we work to improve those things. But if physically they are able to do some of my exercises that I do during a functional exam, they might not need one. I see plenty of clients that come to me because a provider has thought maybe they need one, but
mhm,
I focus on the form and the function first. And if
mhm,
we are able to accomplish our goals without undergoing the procedure, absolutely.
mhm,
Absolutely. I've
mhm,
had some that I've said, you're right there borderline. I think that you could get a little bit more of the movement with a release, yes, but am I saying you have to for my program? No. And
mhm,
but I, on the other side of that, I have had some that they come to me and they're so restricted that there's no way that they can do any of my exercises. So everyone's
mhm,
a little bit different. Everyone's path is different. I
mhm,
don't make the final call when it
mhm,
comes to a release. The provider who's doing that release does. And
mhm.
so
Yeah.
I will have everyone, whether I say, I would do it right now or I would go get another opinion, I'll have them go with one of my providers who does the actual release and make sure that they're comfortable with that procedure.
Yeah, sounds good. So I see that you've also taught some continuing education courses. So what has that been like for you teaching CE? Is there anything that you try to do when you teach a course to keep it engaging or fun or not get too nervous?
And so, fun fact about me, public speaking
Mhm,
used to be terrible. I was terrified. And so when Indiana Dental Hygiene Association had asked me to speak at one of our conventions, I wanted to do it so bad because I want to share my knowledge, and I want to make the impact, right? I want to get it out there. But I'll tell you, the first and I had a beautiful, beautiful presentation that I had spent forever on. I had all my notes right there just in case. And and it went very well, but it's, for me, it's just I focus on the big picture. I focus on why this is important, why this is a passion for me. And
Mhm,
because of that, I've been able to put some things aside. I spoke with the chiropractic at a chiropractic convention. That
mhm,
one, it was very unexpected. I was
mhm,
honored they even reached out and asked me to come and talk about what I do and how we can
mhm,
tie that in, because medical dental integration is huge. And the more of that that I can bring to the table, the better.
mhm,
And the more I can educate other providers on the importance of what we do on this side, it's it's huge. And
mhm,
so that has been what drives me, is my passion for making the impact, not only
mhm,
for my patients, but for every patient and for
mhm,
other providers' patients in every different
mhm.
field.
Mhm. That's really good to focus on the issue and not focus on yourself. Because
Mhm.
so many of us, we can get in our head about why we're not ready yet or why we shouldn't
Oh,
do it.
yes.
So
And you'll
so
never be ready, you know, I'm big on that. I
mhm,
can change something 100 times and still feel like I'm not 100% ready. Or if I go
mhm,
into it 20 minutes before I go on stage, I think, I don't know if I'm ready. But then,
mhm,
once we start talking and I start presenting, it's the passion for me that carries me
mhm.
through.
Oh, wonderful. So I also saw on your Instagram you were at an event or part of an event, Hygienist Inspired. Can you
Yes.
tell me more about what that event is?
Absolutely. So, Hygienist Inspired is a
Mhm,
program with the American Dental Hygienists Association, and we have partnered with the Delta Dental Foundation, and we are making strides to address shortages. We are bringing diversity to the field. We're gaining momentum on this field. We have ambassadors from, I think we're at 7 or 8 different states now. We ask for allies all the time. It doesn't have to be someone who is a dental hygienist. It can be anyone, but we also do a lot of chair side recruitment. So that is near
mhm,
and dear to me because I
mhm,
was chair side recruited.
mhm,
Spreading the word about what we're doing, and what I have also found is, for me, it just brings something positive to this field. I've been speaking at a lot of different high schools where I'll do career fairs and things right now in my area. And that's also important to me because when I was a high school student, I wasn't sure that, what the path was to become a dental hygienist. And I
mhm,
didn't think about it that much as going to school to be a dental hygienist. And there's so many benefits. And especially now, right now you can go to school in our 2-year program, 1 year of
mhm.
prerequisites, and be working right after that as a clinical dental
Really?
hygienist. And so, while there's many paths to take that further, you can be working in 3 years. And
Mhm,
we need that. We need people out there in the field working who love
mhm,
it and want to be here and want to be part of it. So me
mhm,
gaining and trying to tell people about how fun and all the different things you can do. We don't just have to sit and be in a clinical setting all day because it's not for
mhm.
everybody. So much
Yeah.
more we can do with this field. So that has been a huge highlight for me actually. I get very excited
Mhm,
when I talk about it because that has given me an opportunity to meet so many hygienists from all over the country who are
mhm,
doing absolutely amazing things. These
mhm,
hygienists, they also, some of them have their own businesses. A lot of them are in leadership positions that they're working on a state or on a national level. They have their own foundations. They're
mhm.
running so much, and it just, to be surrounded by people like that who are working so hard to bring access to care all across the country. There's nothing like it. It's an amazing feeling and it's an amazing thing to be a part of.
Yeah, it's always so energizing being around other hygienists, hearing what they're
Yes.
doing, and you say, "Okay, let me see what else I can do."
It's so neat. It's so neat. And so
Mhm,
I encourage every hygienist
mhm,
or anyone else, who's interested to check
mhm,
out Hygienist Inspired and see
mhm,
what we're doing. Take the Ally Pledge.
mhm,
And, with Delta Dental Foundation is also offering all kinds of scholarship opportunities that they're giving to people in a lot of these underserved communities that just wouldn't think of themselves as going into the programs. And we're gaining momentum of them wanting to be part of this, and once they're accepted, we give them money to go. So how neat is that?
I'll have to tell my niece about that, and
You should. You absolutely should mention that to her. Give her my
Mhm.
information. I'd be happy to talk with her about any of it.
Okay, awesome. So do you have any upcoming or future goals that you can tell us about?
Well, I hope I don't want to say too much. I don't want to get ahead of myself, but I hope to jump into some leadership positions. I
Mhm,
recently have taken a little bit more of an interest in advocacy lately. As you
mhm,
know, there's a lot going on
mhm,
across the country right now.
mhm,
And gaining the knowledge and the resources to be able to help right here in my own state. I
mhm,
sometimes I feel that there has been some changes that are more from maybe of a money aspect, or not we've it's almost like sometimes we forget that we've made an oath, a very important one, and we are
mhm,
here to protect the public and do no
mhm,
harm. And we have a very high percentage of people here in my state who don't have access to dental care. So
mhm,
in these next few years, my hope is to jump into leadership and
mhm,
to focus on some legal studies to be
mhm.
able to advocate better for the future of hygiene.
Very exciting. Well, we can't wait to see what you are up to. And
Thank
thank
you.
you so much for sharing that. And we love to support you in any way that we can at Hygiene Elevated.
So
So we have
much.
two questions we always close with. So the first question, what is something you feel like it took you too long to figure out, like you wish you could have jump started your learning process?
Oh, absolutely, airway dentistry. Orofacial
Mhm,
myofunctional therapy. It took me way too
mhm,
long, and
mhm,
that I blamed myself a little bit for not doing the research, but I can honestly say I had just never heard of it. And
mhm,
so I always tell people jump into it now. It's never too
mhm,
late. It's
mhm,
never too late to hurt your
mhm,
to help your patients, but eventually I would like to help get some of that into schools and be a voice that can help put
mhm,
that into the dental hygiene program so hygienists
mhm,
come out knowing
mhm.
about it without having to go back later.
Yeah, I think that would be so impactful if it was part of our original education.
Absolutely.
So for the practicing hygienist who's working chairside, can you share like a few things that you would like them to look out for? For example, in my office, we screen for the Mallampati score and we ask them
Mhm.
about their sleep health. But
Wonderful.
people report how they want to report. Any Is there anything else you think that we should be looking out for or asking
One of
in
my big
addition
ones.
to the medical history review?
And I have talked to a couple offices about actually including an Epworth Sleepiness Scale test in their
Mhm,
paperwork. And
mhm,
what that does is if they score below a certain grade, they're
mhm,
okay. But it says on the bottom, if you score above so and so number, further studies are recommended by your physician or a sleep study.
mhm,
That has helped, especially in my practice, because that's a big eye opener for patients. You're not
mhm,
directing them in one way. You're not telling them how to answer these. They're doing this all on their own without you. And then
mhm,
their mind starts thinking, and they think,
mhm,
well, maybe this is more of a problem. When
mhm,
the other thing I look at is, especially on the incisal edges of these lower front teeth, or, if there's a lot of wear there,
mhm,
excuse me, or if there's a lot of chipping on the upper front teeth. And I tell people, they're like, oh, I'm not grinding. I don't think I'm grinding. But when we see all those wear patterns and those chips everywhere, they certainly are. And I
mhm,
take intraorals of it because there's no
mhm,
denying it when you see it. And
mhm,
I explain to them that a lot of times when you're asleep, you don't know. You're
mhm,
doing this, and you might not necessarily be waking up with headaches. A lot of them are, but not always.
mhm,
And I tell them how the tongue, when it falls in the throat, that lower jaw, your body pushes it forward as a natural response to try to open your airway. It's your body
mhm,
is literally begging for oxygen. And then they
mhm,
start thinking about it and they think, well, I do sleep 10 hours and feel like I only got two.
mhm,
And so those are things that, from a clinical standpoint, that I'm talking about and looking at. And, I
mhm,
see a lot of the dry lips. And if my mirror is fogging up all the time, I see that they're breathing through the mouth. And so I'll
mhm,
ask them, can you physically breathe through the nose? I've had multiple patients that cannot physically breathe through their nose and never even knew it. Never
mhm,
knew it. I've had others that I'll do a pulse ox reading and I'll ask them to breathe through the nose exclusively for 3 minutes. We
mhm,
get about 30 seconds in, the heart rate goes crazy. They're
mhm,
starting to panic. I'm seeing some redness happening. And so
Mhm.
I stop them and I say, so you think that you're breathing through the nose exclusively,
Mhm.
but
Mhm.
it appears here that we're having some problems with that. And so
Mhm.
just doing little things like that to make them experience that for themselves, that maybe I'm not always breathing through my nose, or maybe I don't have
Mhm.
correct tongue posture.
Mhm.
Maybe, and then they're like, okay, they're connecting the dots themselves. And then now they're
Mhm.
interested all of a sudden, willing
Yeah.
to get the help.
In our office, we use an iTero scanner and we do it on a
Yes.
yearly basis. And one of the coolest features for it is the time lapse feature, because then you
Mhm.
can compare it goes back and forth last year to this year. And so there's no denying you see that the tooth chipped.
I love
So for
that.
me, it's one of the best tools they came up with. And then we also do
Mhm.
salivary testing and we're able to see,
Ah,
like, okay, this bacteria or bacterium sinusitis, whatever it's called, is super high, and this is high with patients who snore. So we are trying our best as a general dental office to look out for some things to refer out. And another thing we're doing in my
perfect.
office, that we signed up for like a team training for sleep medicine.
Okay.
So 1 or 2 Wednesdays a month for our morning huddle, we're watching like these little 10 or 15-minute videos to get us thinking about sleep more. But I feel
Oh,
like it's a
good.
big thing to learn. It takes time, but it's worth it to help people be healthier and to be happier. So it's
It
good
is, I
tips.
agree, and I love how you guys are doing that, how you're spreading it
Mhm,
out a little bit,
mhm,
so it's not
mhm,
too much information to take all at once.
mhm,
It keeps the
mhm,
momentum going, right? And that's amazing, and,
mhm,
you mentioned the iTero scanner, we just have a new one in our practice now that I'm excited
mhm,
about because,
mhm,
wow, technology has come so far, and
mhm,
benefit, right? For to be able
mhm,
to do that, where the
mhm,
patient can really visualize what's
mhm,
happening, that's a big
mhm.
deal. They deserve
It's
that.
really cool technology. All right, last question. So, if you were to go back and tell new grad Haley something, what would you tell yourself?
Ooh, that's a good one. I would tell myself, "Don't give up, don't be afraid, and
Mhm,
speak up." Because
mm,
I think for a long time, because
mhm,
I felt that I was new, I kept some of my opinions to myself, or I didn't feel like I was ready to be a part of leadership.
mhm,
I felt like I needed to have the invitation to be
mhm,
on and part of like ADHA and IDHA, and I would, if I could go back in time, I would have joined ADHA right away and
mhm,
never let that go, because that has been the biggest game changer for my career, is having that support at every level and
mhm,
having the network opportunity, and I truly believe that it prevents burnout. I think that
mhm,
when you are surrounded by people who share a passion, that
mhm,
there is no turning back and
mhm,
you're always uplifting each other. And
mhm,
so being part of, any association for any career, I feel like, it just brings so much camaraderie, and it's good to see what other people are doing or what struggles that they might be having, because
mhm,
this can be a lonely field if you're not
mhm,
careful.
mhm,
So yeah, speak up and become a member. Join your
mhm,
associations and be
mhm,
actively involved.
mhm. Really, really good advice. Oh, it was such a pleasure for me to talk with you. So, if our listeners want to connect with you or find you, where can they find you?
My website is www.indymyo.com, INDYMYO. I'm
Mhm,
also on Instagram at Indy_Myo, and I'm on Facebook as well. So feel free to reach out anytime on my website. I have my
mhm,
email and everything. I'm an open book, whether it be that you're just looking to help your patients more, or you just want to connect and get to know me. Let's go have
mhm,
coffee, whatever you want to do. I'm here
mhm,
for it. I'm here to
mhm,
talk about any of the things that I do and any of the roles
mhm,
that I can help fulfill. I'm all
mhm.
here for it. And thank you so much, Olivia. This has been wonderful.
My pleasure, and enjoy your vacation.
Thank you so much. We'll talk soon.
Okay.